with our caregiver provider networks through our area agency on aging disability here in GNRC and elsewhere in the transportation networks, collaborating with our senior centers and going to these community workshops, and then disseminating our online survey. So we're going to kind of overview a little bit of what we've done so far in our in-person outreach. So in May, we had 2 in-person outreach events. You see some of the photos of those events on the screen. And we're going to kind of talk through some of the things that we learned from them, hear some feedback from y'all, and then kind of talk about where we're going to go from here. So just kind of as an overview of what we did, we had an event at Ajax Turner Senior Center in Clarksville. We're estimating about 70 attendees at this event, both people who walked through the stations, and also going out and talking to different community members at the senior center in their cafeteria. So things that we heard there were that rides specifically to senior centers are reliable, use of the CTS Link service, and then also some issues accessing MCHRA services. We also went to Lebanon Senior Center the following week, again, estimating about 50 attendees for folks who came through our stations, and then also going out and talking to people in their cafeteria at the senior center. Similar trends with rides to senior centers being reliable, also use of Wilson Ride services and MCHRA. Saw some challenges with non-recurring scheduled trips being more difficult if things come up with shorter notice. So those were some of the takeaways that we had seen at our events. And we just wanted to take a moment to see, first, shout out to our committee members who were in attendance at these events. Thank you all so much for taking the time to be there and for answering questions about your respective agencies and fields while you were there. So we just want to take a moment to see if any of the agencies who were present at these events had any takeaways that they noticed or trends they saw in the questions that people were asking or any feedback they got.
And folks online, feel free to unmute. Mike, I know you were at the Clarksville event.
Yeah, no, it's pretty much what we thought it was going to be. They want more service, later service. They want Sunday service. They want more time. That's a bigger challenge. And I tried explaining to most of them that Sunday service is probably not going to happen anytime soon. Later service could happen if I got more drivers. We're always looking at that, but that was kind of what the takeaways were. They wanted to know, how do we get more? I said, we need more staff. That's our biggest challenge right now, is staffing.
Thanks, Mike.
We did hear about the limited trips between Clarksville and Nashville, which we are aware of. It's commuter-oriented service, which is basically, unless you are commuting and you using it during those times, it's not conducive to do anything else. But some of the people that we talked to were aware of it, and there's a lady that, interestingly, she uses it to get to the airport for volunteering. So that was interesting to hear. But yeah, we know that we want to start making some changes to the regional service, ideally having something that runs, even if it's every hour, at least during the most portions of the day, but funding is usually the limitation. So, yeah.
To Felix and Mike, as operators of public transit service, do you think that the engagement and feedback that you're getting at events like these pairs well with the feedback you get at your general events where you're mostly talking about fixed route service? Or is it difficult for you to, field those questions and understand what people's needs are, offering both services, the paratransit or the demand response versus fixed route?
This was the first event for me that we actually just basically focused on paratransit. Usually the fixed routes, it happens every year. We talk about trying to do route changes, and those folks are pretty boisterous. Whereas the paratransit folks, we don't normally focus on them. They come to us. They're kind of like a captive audience.
Mhm.
And I did hear some folks that were going. The lady went from Clarksville to the airport. She was walking me through it, and I said, "Well, I did take the groom bus down there," and she said, "Yeah, but that was $25, wasn't it?" And I said, "Yes." She goes, "I can get there for like $5 or whatever it was." So she was walking me through that, and for me, it was a timing thing. I just needed to be there at 5 in the morning, and I couldn't get there on a MTA bus to get down there in time for the airport. But she was definitely using it for that factor, and on her limited income, it was definitely well worth her time to sit there and wait to get onto the buses. The challenge is I can't get her to exit 11 on a CTS bus. That was another challenge we knew we had, but she was definitely boisterous about that, trying to get there.
Right.
Yeah, that connection that Mike mentioned, it's a limitation right now. There is not a connection between our regional service and CTS at the Park and Ride location on exit 11. Whereas I think there used to be before when we were at Route 8, exit 8, I should say. But we do not, I mean, the service that we offer regionally is just commuter service, is fixed route. We don't have anything that we offer in terms of paratransit outside of Davidson County. And, that's MTA versus RTA.
Mhm.
But I agree. I mean, the paratransit, usually riders don't show up unless they have something really to complain about. And most of the people that we hear from are fixed route riders, but I think this is a little different. We do have our own engagement for, a group of paratransit riders that we meet with every other month. So there's a committee that we meet with, and we hear through them a lot of those things. But usually on public forums like that, when you go out, you don't really hear much about that. So this was interesting, not particularly related to us because we do not offer that service, but it was good to hear about some people finding out that we had a service that connects between the two counties and they were not aware of.
Right.
But evidently they would like to see more of that.
Yeah, and I think that was one of my key takeaways talking to folks is in such a variety of knowledge on what existing options there are. Some folks knew how to use, and I'll probably call out Anna Perry since she's on the call. We heard a lot at both senior centers about how much people liked, like they called it the subscription service, where they could get a ride to the senior center every day at the exact same time through MCHRA, and how that worked really well. So I don't know what your engagement has been like, Anna, through that, but that was one of the key takeaways we got.
Oh, good, good. Yeah, that's something new that we've been able to start with the new software, and it has definitely been a plus. I wasn't able to attend either. I was actually on vacation during one, and then I got called out for the Ajax Center, but I did send some of my staff, and the feedback I got from the Ajax Center is there's so much confusion when it comes to who we can and cannot transport in the city limits of Clarksville. It's a difficult thing for us to explain to a lot of the passengers that are wanting our service, but they live within Clarksville Transit's area. So we do struggle with that. But that was the main thing the main takeaway I had is we need to find a way to try to communicate all those different things, so that we can make sure that we're putting people in the right direction where they need to be.
Right. And I think that's a main theme that we're seeing throughout all of our outreach that we're going to have to start thinking about when we start putting together strategies, is just information sharing and how folks find out about services and how we could do better and have maybe a database or some other solution. Another thing I heard from Wilson Rides and from a couple specific people that take Wilson Rides at the Lebanon Senior Center was that there is a desire for expanded service to connect them to different counties. And Harry, I don't know if you've encountered this with Senior Rides, saying a Senior Ride and Wilson Rides are somewhat similar, but they were saying that there's a desire for a service to connect them to the VA in Rutherford County because it's just across the Wilson County boundary. Because there's service to Nashville from there. There's a shuttle service. So that's definitely another key takeaway that we heard was that there's these non-recurring trips that may not be offered, but there's enough demand, but it's not necessarily being communicated into actually expanded service.
Daniel, this is Carrie with Senior Right Nashville. I would suspect that the surrounding counties may experience that request at a greater level than we do here in Nashville, since Davidson County is such a medical hub. But I do think that getting, the need for people in surrounding counties to access medical destinations is a real need, as well as a challenge when you're reliant on volunteer drivers who are more interested in shorter trips.
Mm-hmm.
Daniel, I just would say it, following up on Carrie, that was part of the thought process when we first visualized Senior Ride Nashville, was to in fact find, like now Wilson Rides and then Sumner County, that organizations that would be based there. Mm-hmm. Because the unique travel patterns from those residents that live in those areas could be better addressed than by an expansion out from Senior Ride Nashville. Mm-hmm. So I've got the floor. A quick question for you, for others. In these meetings, these two meetings in Lebanon and Clarksville, were the participants in those meetings people who had some familiarity already with a particular service of some type? And I compare that kind of attendee with someone who hasn't done anything.
It was a mix of both.
A mix of both.
And that's what I think went really well about the event, was because we were able to gather information and have conversations with folks that were at totally different parts of the spectrum. So like some folks took MCHRA every day to the senior center. They had reliable transportation. They may have had ideas on how to get other places. And that's another key takeaway that we heard, was that, they were like, well, we can get to the senior center every day, but if we need to go grocery shopping or we need to add a trip on to that trip, it's difficult. And the other thing we heard, there were a fair amount, we saw this through our survey too, majority of people are still able to drive. But I think a conversation that we had pretty frequently was that, okay, well, they're aware that eventually they won't be able to drive. And so how do we prepare them for the options that they're going to have to be able to access once they get there? Which is not a question that we had considered before, but now, it's something that we've put on our list. So it was I would say it was a good mix between folks who are aware, who aren't aware. But I also think that having the providers there was really helpful, because folks who walked in didn't know that Mid-Cumberland existed, or didn't know that Wilson Rides existed, or CTS Link existed, could go right to the folks who offer it and learn more about it.
It's great. Great, thanks.
And one of the things that we also found for folks who were using these services is that they had found out about them from the senior center. So they had found out about Mid-Cumberland from going to the senior center. So like looking at the senior centers as a good way to disseminate information as well. And recognizing that we're talking with people who made their way to the senior center that day. So we understand that there are some limitations for reaching people who might not have had that transportation to the senior center that day. So that is a good segue into kind of what I want to talk about next, which is our outreach through our survey. So we are continuing our in-person outreach efforts, and we will continue to do that to different senior centers and community locations next month, and we'll talk a little bit more about that. And one of the other main ways that we're trying to reach people is through our online survey. And we have we're going to have some physical copies of the survey that we've been distributing as well. But just want to take a moment to talk about what we've done with the survey so far and what we've learned. So this is what we're calling survey number 1, which is the extent of the problem of transportation access. This is kind of our general public survey that we're using to find out about people's transportation challenges for themselves or people that they care for. So this is our link again to that survey. Again, we would appreciate your help as much as possible to disseminate this survey to your communities so that the survey can reach as many people as possible. We have a link and a QR code here. Also, if you would like a PDF version sent to you or physical copy sent to you, we can do that as well. So just a little bit of an overview of how the survey is going so far, what we've learned so far. We have had 85 total responses to date. When we look at the respondent locations so far, the majority have been in Clarksville and Lebanon, which is where our in-person outreach events have happened. So the survey respondents have largely been from our events or corresponding. 6 respondents from Nashville. So we hope to grow the number of respondents in our surrounding communities as well as we move through this process. Little bit of a highlight of some of the information we've learned so far in the survey. 44% have indicated that trip planning impacts their schedule or quality of life most of the time. And then 67% have indicated that they are able to drive to most places. So those are kind of some of the highlights that we've learned so far. Again, this is an ongoing effort, and we hope to learn more as we continue on. So some of the key takeaways to date that we've learned through survey, through talking to folks, through our general efforts that we've had, is that service demands are increasing as the number of people who are transportation disadvantaged grows, or people who are needing access to these services grow, and that there's funding is limited for these transportation options. And that people who are accessing these transportation options, the transportation, are limited in their income and spending power. We found that fixed route service does not serve all desired destinations, and that those needing services have unique circumstances and needs with varying levels of ability or disability, and that there are uneven access to options. And then finally, that the providers are experiencing labor shortages and rising costs that are challenges for their services. So we kind of want to open the floor up again to feedback from the committee. What feedback do you have on the key takeaways to date that we've gone through so far? Is this in alignment with what you're seeing? Do you have any questions or comments related to what we've summarized to this point?
And I'll mention real quick, since we talked about the survey and have clearly seen that the most success we've had is administering the survey in person to folks that are already there. Our aging team is going to be helping us disseminate the survey through their Medicare counseling events, through other public events that they're hosting, through their nutrition visits, as well as disseminating the QR code as they just attend any events that they're doing. So we're hoping that that's going to increase the number of people that are taking the survey and result in a little bit more geographic equity. But another question to add to this feedback is other ideas that you all have to disseminate the survey. Are there events that we need to be attending as staff where we can administer it then and there? We found that administering the survey is pretty easy with folks because it's more of a conversation style. None of the questions are required, and they're all pretty accessible questions. And so we found that we can easily sit down with folks and just have a conversation about their transportation issues rather than, walking through each survey question formally and, having them take it. So add to those questions, any ideas that you might have?
Those that you received from Clarksville and Lebanon, were they actually completed at those events, or did they take them home? And
there's probably some in there that also were taken home. We don't have a question in there that asks whether you took it at the senior center or at home, but based on the amount of people that we sat down with and the amount of survey responses that we got, I would say the majority of them were taken at the senior center.
So I'm thinking like Paula, like the age well community would be an example. Individual personal social media lists could be an example. I mean, and I would think if it's online, and I haven't looked at the online, I just have the print one, because I assume this is still the same thing. Is there a possibility of getting a sort of a cover comment, a paragraph or some way, so that if a person like me or someone over at Age Well were sending this out to our contacts, we could describe what's coming? I mean, this is a well-done survey. It's not, it's confusing, but the context for why we're even doing this could be described in some fashion, it would seem to me.
We sent around like a blurb,
Okay.
but it was pretty short, and I think what you're asking for is a little bit more in depth of what our process is and why it's important. So we can work on that and send it to everyone so that you can include that in whatever posting that you're doing. Absolutely.
I'm Paula with Age Well, and we sent it out in our newsletter that went out Monday. We included the link on that, and that's a couple thousand people, so maybe
Sure.
Through the 13 counties. My suggestion is contacting, there's a group in Southeast Nashville called The Branch, and they're a food bank, but they also do home delivered meals. They do English as a second language, all kind of stuff, but they home deliver meals to 300 older adults.
Okay.
So they potentially could get you a very diverse ethnic as well as racial response. And that's a corridor that we know is struggling with transportation. So maybe some connections to people who are working with older adults that could maybe help you, because if Melissa, who's the executive director, asks people to fill it out, they might fill it out more so than some of us who don't know them.
Right. That's a great point.
I'm going to be on Thursday. Matthew Walker is having an event. I don't know. I think Rachel is going from the area,
Yeah.
you know, for you guys. That might be a way to get some people or have some conversations with those people at Matthew Walker.
Yeah.
And it could just be that somebody's just there informally, just talking to people as they're sitting down, or, you know.
Coordinate with the aging team to make sure.
Yeah, you know, just maybe at that event, just sitting, you know, because after a while they all go through their trick or treating, as we call it, and then they sit, and somebody can just sit and talk with them. That might be a great, if you could find events like that where you just casually are talking to people.
And you bring up a good point. We're happy to get the survey translated.
Yeah.
I think
if-
definitely in that Southeast corridor, Spanish and maybe Kurdish, Arabic.
Yeah.
I think that, but I think they could potentially be a great resource. I know they kind of do Davidson and that northern Rutherford. They would be a great resource to get some diverse comments.
Okay. Thanks. Any other feedback on the specific survey results? I guess to anyone, whether it's providers, is this consistent with the type of feedback that you're receiving, that you receive on a regular basis? And then folks that are not providers, do you hear this from your clients? Is there anything?
Calls? We get a lot of calls from people that want that one up. Hey, I need to go to the grocery store. I need to go get my hair done. And Senior Ride is great, but they have such, you know, that's a volunteer based,
Right.
you know. But it's a great avenue of sorts, but it's those one-offs. It's the like every day going to the senior center that's scheduled, but all of a sudden I need to go have an x-ray,
Yeah.
you know, and you need a ride. So I think it's that. I think there's also the fear. I feel like, and I think we may talk about it soon, but we get the feedback from the counties that don't have a public transit. Like Clarksville has one, Murfreesboro, Williamson, but like, what about the people in Dixon, the people in Humphreys, you know, those counties that are a little more rural? What are those seniors experiencing?
Right.
But I definitely think communication of stuff that's out there is key as well.
Mhm.
Definitely.
We do get a lot of demand on our access service, and you know, we have contractors that we work with, you know, for overflow. And it puts a lot of stress on it. First of all, you know, not everybody qualifies, so you have to be able, even just for being, you know, you need to have mobility issues, you have to be disabled or whatever. So you have to go through a certification process, and not everybody qualifies. You may be granted a temporary ability to use it. So, and you know, on top of that, we provide that countywide. So, you know, it is very helpful for a lot of people. It is very costly to operate. So, you know, to the degree that we can, we were trying to, you know, pair trips when we can, but that's very difficult when you can go from Jolton to Antioch, for example. So sometimes it's a little bit hard to match those trips. In the past, we've tried to make efforts to push people that are able to use the fixed route service. And we've been considering options, including, let them go free, for example, if you can use access, but you choose to use fixed route, things like that. So we still working on that. We developed a access report last year that we're trying to implement some of those recommendations, but it is challenging. So to the degree that sometimes, that we can partner with other agencies. I know we've had conversations with Carrie about senior rides, because there are all different types of trips that can be more conducive for somebody to use a different provider, for example. And then, just make sure that the resources are not exhausted or stressed. And just being able to identify those opportunities when I guess, when we go through the solicitation process for awarding, the MSID and the JARC funding. One of the things is how can agencies better partner between each other? Because there could be some duplicity there. There could be some overlapping in terms of the populations that they serve.
Yeah.
And I think resources can be shared, but it's always a little hard. Every agency is kind of focused on the service and the population that they serve. So sometimes it's try to get them a little bit beyond that and talk to each other and see whether there are opportunities. I know there's challenges about doing that, but there's opportunities also to maximize resources.
Yeah, and I agree. Having gone through the evaluation process for 4 years now, that's what I notice every year is because so many of the nonprofit providers are offering service to a really specific subset of the population, it's hard for them to coordinate with folks like MCHRA that are offering to a much broader set of the population. And I think it's difficult to coordinate to the extent where it's like, that a service is being duplicated, but because it's specifically offering service for dialysis patients, for example, you're like, well, this service still needs to exist, but it's really hard to coordinate between them and maybe MCHRA. And if they're in Davidson County, then Access Ride and also Senior Ride. So another question I have for the transit agencies, do you find that a certain percentage of your trips on your paratransit service are to access fixed route services, or are they mainly trips, origin destination?
Yeah, it's just pretty much door-to-door services. Rarely. One of the things that we're trying to do with Wiggle Link is also providing that it's an additional cost, though. But I guess that's what I was trying to, if somebody uses Wiggle Link, for example, to get to a bus stop, that somebody that may be eligible for access. So maybe, the Wiggle Link trip, it's free. They just pay the cost of the bus route, but the fixed route bus.
Right.
So, but we haven't really seen much of a use from people that need that type of that have mobility needs using Wiggle Link. It's mostly just Uber. So Mobility Solutions, which is the company that we use for any accessible vehicles, we don't really see much of a demand yet on that. So it's the option is there if somebody needs to use it, but majority of access trips are door to door, not necessarily to a fixed route connection.
Right.
This may be stretching it, but we're talking about the future and planning, picking up on what Felix is saying. We also want to talk about the fixed route, quote, structure in the future. And we're all talking right now about how we connect to fixed route, and it doesn't really work with Wiggle Link to the fixed route. But in Metro, in Nashville, if choose how you move passes.
Right.
One of the key features of that is going to be to really rethink the whole fixed route structure to get to more destinations. A key element in that will be transit centers, and another key element will be sidewalk access.
Right.
And I think it's important to say here that we're talking about down at that point as well. And that would make it even more vital to have the connectivity into what it would be a much more vigorous fixed route network 10 years from now. And again, that's beyond the life cycle of a number of us, but I think we have to keep that perspective in mind, because to me, an element of choose how you move is to really open that whole fixed route network up to more different destinations, more accessible destinations.
And I don't think it's beyond the life of the plan. So I think
No.
that's a really good point. And I think it's something that we're watching, and we're trying to figure out how we're gonna take into consideration in the plan, especially since this plan is gonna be done.
Sidewalk is one of the main barriers when you ask somebody that maybe is in a wheelchair or have mobility issues to be able to use fixed route. So one of the things that we thought when we were looking at this access project was, if there are locations that can be easier, when we talk to the city about, prioritizing some of those locations for accessibility in terms of the sidewalks and safety crosswalks and things of that nature, that will make it easier to access a bus stop.
Yeah.
Yeah, like Hickory Hollow Towers is up on a hill. The bus stop's at the end of their driveway, but it's a steep hill, and the senior high rise is up here. So for them to walk up and down the hill to catch the bus to get to the sidewalk is a challenge. I don't know who built that building or when they built that, but it's that accessibility to the sidewalk as well.
Probably pre-ADA.
I'm sure it was. It's probably in the 60s.
We try to encourage our paratransit riders to get on the fixed routes, but it doesn't happen. They want to go door to door. They can't wait outside at a bus stop for 10 minutes or an hour or half hour for the next bus. So we try to encourage them to get a little more freer mobility, but most of them will stay on paratransit, and that's where they're at.
Well, I think that leads into our more in-depth discussion. You guys have already answered some of the questions we're going to ask, but we wanted to go through a couple questions that we came up with sort of in response to the feedback we've been hearing from both this committee as well as through the outreach events. So we'll start with these first three, and this goes for all of you, whether you're public transportation providers or resource agencies or nonprofits. So how often are trips denied due to inadequate capacity? What are the most common trip requests that you're unable to fulfill? We've already talked about some of those, whether they're outside your service area or outside your service hours. And then what barriers exist to expanding service? I'll just open it up for any answers to
I
those
think what
questions.
we get a lot of calls at Agewell in our line, and a lot of people want to ride to church. And I feel like the faith communities need to step into that space for their people. So that's kind of when we get. So I think it was somebody that said Sunday, people want Sunday. And so that's kind of, a lot of the calls we get are like to ride public transit. Now, if you go, the Parthenon Towers, there used to be a Piggly Wiggly, and now the Piggly Wiggly's gone. And so for them to access, they used to be able to ride their motorized wheelchairs to Piggly Wiggly and go back, and now there's not places. So that's kind of an issue that we hear is going to the grocery store, the simple things like that we all take for granted that drive, is, just the simple things, getting your hair done, going to the grocery store. And the problem they see with Access Ride is they don't qualify. They're just maybe under the income or, just don't qualify for Access Ride, or they don't want to sit and wait for 30 minutes because it's hot, or they're afraid. A lot of our older adults are afraid of public, riding the bus and that kind of thing. So I think those are some of the barriers or some of the requests we see that are not being filled in Senior Ride and Wilson Rides, and Community Life Bridge can't do it all.
Right, and that's where that impact on quality of life ties in. Ed, I know you mentioned, to respond to her comment, you mentioned the need and availability of faith-based transportation service. And this sort of goes for anybody who has to answer that question, but are there existing services that are useful and have been successful? Because I know that some churches will transport, their congregation to events, like at the symphony, for example. But are those services available often, or is it just for specific events?
I've don't know of any that have been, except for like individual congregations doing it
Right.
with their people.
Yeah, they're primarily for specific events and they're primarily to serve members of the community, the church or what synagogue or whatever. What's missing, and just in some informal conversations with people, because I go to a church, it is not large enough to have our own vehicles. But we have a church that's the same denomination down the street that has a couple of vehicles. So we've had some discussions about, is there a way, I mean, those just sit there most of the time.
Mhm.
And is there a way to coordinate maybe using those things? And the answer is always sort of yes, but then immediately things like liability insurance and who's going to be the driver and whose schedule overrides whose request. And I think the situation is ready-made for there to be a pilot somewhere to come in and say, we can help organize. We are the people that have the most experience on moving people around this group. And maybe we could do a pilot to see if we could utilize those vehicles. It'd be one of those pilots where you just sort of start saying, if at any point it just doesn't look like it'll work, we'll back off. We're not going to be known as having a failure here. But I think it's worth pursuing. And particularly that neighborhood impact, because the churches and the hospitals and grocery stores, certainly in the part of Nashville where I live, they're all pretty close.
Right.
And I could see a network of those 2 or 3 buses
Sure.
being used to provide those special trips that people kind of want to make.
Yeah. Carrie, I see your hand is up.
Yes, piggybacking on what Ed said, of course, Ed was a founding board member with Senior Ride in Nashville and instrumental to the progress that we've experienced to date. We have completed over 38,000 trips since 2017. And, offering what we provide now is door-to-door transportation service. We supplement our volunteer driving corps with paid drivers. And so to answer question number 3, what barriers exist to expanding service? It is drivers, whether it's volunteers or, having the resources to attract and retain more paid drivers. And I remember hearing from other service providers at this table a few months ago that, attracting and retaining drivers is a challenge. But going back to Ed's comments, we at Senior Ride Nashville have just completed a 5-year expansion planning process. We completed that in 2023. And while we do currently provide a one-to-one service, a door-to-door service, we are preparing for new program types over the next 5 years. So one of the things that we will be piloting this year, starting with the Matthew Walker Comprehensive Health Center this summer, is a partnership program where we will be partnering with organizations in the community that serve older adults but experience transportation as a barrier into providing their core mission. And so that is one area where we see opportunity for enhanced services in addition to carpooling. But to Ed's point on the group transportation piece, that is going to be a little bit further down. That's going to be coming probably 1 to 2 years from now, when we do anticipate piloting group transportation and exactly the model that Ed has recommended. We're going to need to find partners in the community that we can work with, utilizing and sharing assets so that we can kind of test this new service type before, we invest in, purchasing or leasing vehicles or whatever, kind of going through that evaluation process. So we definitely have those plans on our agenda for the long term.
That's really great to hear. And I think that gives us on staff a lot of ideas. in terms of what we can recommend. Because I think, this conversation, the theme is like, okay, well, how do we fill the gaps? And I think what we've been talking internally about is like what, in terms of how we're going to fill those gaps, and we can get into this conversation way later in the plan discussion, but just so you know how we're thinking, it's sort of the short term, midterm, long term. And I think your point about the choose how you move, that factors into the mid and long term. But our short term solutions, how can we, and I think Carrie's onto the right point of what can we do immediately to expand service. And like Gail Wilson from Wilson Rides mentioned the same thing. She's like, if we can get enough money next year for 3 additional drivers, we can offer service to the VA in Rutherford County. And that would make a difference for, a number of people. So those are the kinds of like short-term solutions that we've been talking about internally that we'll want to talk about going down the line. Mike, I see your hand is up.
Yeah, I had a conversation a couple weeks ago with the FTA. With the shortage of drivers, we've reduced a couple fixed routes on the half an hour. We're just down to hour routes now. But that also pushes over into the ADA as far as paratransit goes, because we went from last year at this time about 160 riders a day. We're about 250 today with the same staffing level. So I said, okay, so what happens if I start denying rides because I don't have the availability of drivers? And what the FTA told me was, you hire contractors. There's no way I can afford to hire a contractor to run a paratransit bus at the same expense I can run it, let alone try to find the drivers. So that's going to be our challenge in the future, is if I can't get enough drivers, I'm going to have to hire contractors. And that's a whole nother world for me now.
Mm-hmm. Any other responses to these first couple questions?
One that we used to receive, and we addressed that a few years ago, was so anybody that is an Access subscriber, so you need to book your trip at least 24 hours in advance, which was hard for somebody, so they wanted to have the opportunity to have, make decisions on the fly sometimes. So a few years ago, we started the Access on Demand. And that's through contractors, but basically you can schedule a trip within 2 hours, which was something that it's like, if you want to use the fixed route, I mean, the bus might not come immediately, but you can just walk and decide, I'm going to ride the bus now. But for Access riders, it was like, you needed to plan way in advance. So that gave them an opportunity to be a little bit more spontaneous on their trips. If they wanted to go do something at a certain time, you only needed to schedule it within 2 hours of notice. And that helped, and I think it was beneficial for what people wanted to use the service. That was helpful. I think in terms of the partnerships, it's hard to deviate fixed routes. You work on schedules, and sometimes it's like the example of the tower at the top of the hill, and they're like, "Oh, you need to do is bring the bus over here." Well, sometimes the bus doesn't have a place to turn around, or if you take it up the hill, then that just creates, even if it's a few minutes, your schedule and your connections go out, a whack for everything else on the system. Sometimes we've run into this problem with schools. It's also like, take the bus here to serve the school. It's like, well, can the yellow bus meet us at a, neutral location or that is good for both? And maybe we can, the students can get there and we pick them up, or vice versa. We drop them off, and then the yellow bus can come and pick them up and take them to the school, rather than, the fixed route having to go all the way. And I know for people that have limited access, that's one of the issues, right? So if there's opportunities to partner with, let's meet us halfway somewhere, and the person can ride a bus here, and maybe a shuttle that the facility operates or whoever it is can then transport them to the final part of the road of their journey. It could be an opportunity to explore as well.
Yeah, there's a daycare in my neighborhood that partners with Granbury Elementary School, and they have a bus that takes kids straight from the school. It actually goes to the other elementary school in the neighborhood too. It picks up both of them and takes them, they call it the Big Red Bus, and it takes them to daycare. So, I mean, that's the kind of coordination that makes things possible so that parents don't have to go to school and get their kids and take them to daycare. It's just like a one-stop shop. So those are all good points. Carrie, I see you have your hand up. Oh, she took it down. Okay. Well, we can move on to the next set of questions.
Oh, sorry.
Oh, I'm sorry,
I
Carrie. Go ahead.
apologize, Daniel. I didn't take myself off mute. Would you mind to click back to the first round of questions, 1 through 3? I don't have stats off the top of my head of, to answer questions 1 and 2, but I would say this is regularly, and it is very frequent that we are having to deny trips to riders that are currently active riders in our program. We cap the number of trips that a rider is available to take in a given week at 2 trips per week, just to allow, more resources to go around to all. But then beyond that, it is, we have a certain number based on the number of volunteer drivers and contracted drivers that we have on hand. We will have to, we estimate the number of trips that we are able to accommodate on any given day, week by week. And so we do have to set a cap, which the requests exceed caps on a regular and daily basis, I would say. Beyond that, we do have a wait list of people that are interested in entering the program. But like I said, the barriers that we're currently experiencing in terms of just driver availability, be it volunteer or paid drivers, is a limitation to expanding. And in addition to financial resources to hire contracted drivers, because our contract drivers are using their own vehicles. I would say another barrier that we experience is just a gap in insurance and coverage available for personal damage to a paid driver's vehicle is a gap that currently exists that we have not been able to find a workable solution for. And so just wanted to mention that tidbit as well.
Maybe smaller agencies, because it seems like you're doing contract services, Felix, but you're the region's largest transit agency. So maybe smaller agencies don't really have that financial capacity, whether it be public or nonprofit. So that's good to know as well. Any other thoughts on these first 3 questions? Okay, we'll move on. So next 2 are, what are the most difficult components to meeting non-recurring trip requests? And are you seeing any new ridership trends or demands within your organization or clientele?
This is Anna. I'll jump in if you don't mind. So the most difficult for us is because our demand is increasing. We're seeing a lot of new ridership, especially among our seniors. Last month, we had over 1,200 first-time riders throughout our region. So, and that's been the trend since the beginning of the year. So we definitely know the demand is out there. Just trying to meet it all. On the first 3 questions, I agree with everybody else. We're having the same issues with staffing, vehicles, etc. But yeah, so we definitely are seeing an increase in clientele.
Any other thoughts on these? Paula, do you find that, and actually Meg, this could go for you too. How often do you feel that when folks have transportation requests or questions that you're not able to answer them? Or maybe there's not a readily available resource that you feel like can meet their needs?
Like 30, 40%. especially if they're calling us from the rural areas.
That seems to be a theme.
Yeah, there's definitely been a couple calls where they've actually called back because the resource that we provided initially didn't service them. I would say when that does happen, it's mostly because of their very unique location, not just, you know, it was one example would be someone, their father lives somewhere weird around Percy Priest, like almost unaccessible. So getting someone out there, that one was one that, you know, none of the other Nashville agencies could cover because it was just such a unique location. And then our rural places too that are, you know, not often thought of or not a high population to begin with. But often there's a lot of questions that I personally can't answer. So those are pretty easy though. I usually, you know, send them directly to the providers for answers, but their questions don't usually get too complex.
So there, it may be within the service area, but because there's such a unique location that they may not.
Just something, yeah, it may be something that they're not sharing with me too, but
That's always a key too. You never know what they're telling you. They don't tell you
Yeah.
the whole story.
Right, that makes sense. Anna, I wonder, are there specific, you know, you mentioned drivers, but are there other specific reasons why the more rural counties like Stewart, Humphreys, Houston, maybe Trousdale are more difficult?
Not really. Those locations, I don't think we have very many requests that we aren't able to accommodate. We're pretty fortunate with like the grocery stores and if somebody wants to, you know, just go shopping, if we can't accommodate the exact time, we do have the availability to work with them on a time that it will fit within our schedule. But no, I mean, the counties that you just mentioned, we're staffed in those counties. We've got plenty of drivers in those counties. It's our larger counties, like Sumner and Rutherford. Rutherford's always a challenge. But no, I mean, I'm not aware of any needs that we're not able to meet in those more rural areas, other than if we can't find them. that would be our biggest
Which
challenge.
goes back to your
find where
points.
they're at.
Sure, okay, that's good to know. Any other thoughts on these questions?
Are ridership plate like trends changing? Are they going to different places that are unique or stand out? Are they going at times that are different than usual? Still following the same patterns? Okay.
A lot of the requests that people call us for is, some of it is last minute doctors, but it's the general stuff. I need to go get my hair cut, but I need some, like, that may take 20 minutes. And then if access ride, I have to sit there another hour, you know? So it's general stuff. It's groceries, it's doctors. Sometimes I just want to go have lunch with my friends, you know, just the normal things. Yeah, I definitely can see the rural counties needing to come in for doctor's appointments. But hopefully, as some of our providers move into the outlying counties, that might solve some of itself.
And that's something we had on our radar, you know, as Vanderbilt and St. Thomas continue to expand these walk-in clinics and satellite areas. You know, how well is that meeting the demand of rural areas, and are they able to get there? So that's something that's.
Yeah, especially with the hospital, Vanderbilt Hospital in Lebanon. A lot of people are electing to have surgeries out there so that they don't have to come into main campus. Which I don't blame them. So yeah, so I think that could potentially play into it as they expand into like having doctors in more places versus just in the city.
I think this goes to both Anna and Carrie. Are you seeing, well, probably more to Anna than Carrie, but are you seeing increased requests to these walk-in clinics and offshoots of both Vanderbilt and St. Thomas or any other hospitals?
We are. And some of those might be challenging for us to fit in, especially if they're going from a rural county into Davidson. Those are a challenge. You know, they may have to go a little early And they may have to wait for us to get back to them. So that's disheartening for them. But yeah, we're definitely seeing an influx of that.
The majority of senior rides trips are to medical destinations. I don't know that we've experienced, I would have to look closer at the data to see if we've experienced any kind of uptick recently, but historically that's accounted for over 50% of our trips annually. I think the only other trend that comes to mind that we have recognized is our riders are riding more frequently now, requesting more rides now than they had been in previous years.
Felix?
I have a question for probably Anna. You can drop off in Davidson County, but can you pick up in Davidson County?
Only if we bring them back to Davidson County. But no, we don't. We can, if we pick up, I'm sorry, if I pick up in Sumner County, I take to Davidson, I pick up in Davidson and take back. I have to take them back to one of the counties in our service area.
Right, okay.
Which is also a huge challenge because we get requests all the time. If somebody wants us to pick them up in Davidson and bring them into Gallatin and then return them to Davidson. So those are trips we have to deny.
Yeah, because we don't take anybody across county lines. So that's a disconnect there sometimes. And we get a lot of requests like that, even, across the line to Brentwood or something like that, that is still so close, yet we cannot go outside of Davidson County.
Yeah, I think that's an issue we're seeing is I live in Davidson, but my doctor's moved to Brentwood and we can't cross that line, or my doctor's now in Hendersonville. So I think that the transportation from Davidson out, I could foresee being, if your doctor maybe was at Vanderbilt, now they're at Lebanon, a ride out of county. I could see that being an issue. And we have gotten several that are like, I live 2 miles from Williamson County. Can I not get them to bring me? We're like, no,
Yeah.
So
Really specific requests or just different requests than what has historically been offered are really difficult to meet. Okay.
Is that unique in the region, the fact that Davidson residents cannot get outside of Davidson County? Because it sounds like a lot of the other providers will come from, other counties into Davidson or from
Right.
Stewart to,
I think it's, as the city's
Some-
grown, I think it's a new problem.
okay.
Because before everything medical was in
Coming in.
Davidson. So everybody, I feel like I've lived here 32 years, that everybody came into town to go. But now with with Bone and Joint in Franklin, and that's a new thing that people are going out, where before everything was, between Vanderbilt, St. Thomas and HCA, all in that core. And I think it's a new thing.
Okay.
I don't know if it's unique to our county, but I think it's a new thing to our area that before healthcare was not out of the county. It was all in county.
Well, and it's not just healthcare. I mean, I grew up here and I've been in and out, but I've definitely noticed with all the growth that's happened in the region, just the relevance of all the other areas too. I never went to the Wilson County Fair when I was a kid, but now it's like a thing that everyone goes to. And I'm sure that,
Right.
Yeah, could add that to the list of trips that people go to. The Strawberry Festival in Portland is a lot more popular than it used to be. So it's much more of a connected region, but not necessarily with the connections themselves. So
I think that kind of goes to the question 5 as well, to not ignore the demographic trends that we're dealing with. The overall population that we're talking about is increasing. The in-migration rates in Middle Tennessee are higher than the national average, is much higher. And then the shifting of the older population within the counties. You look at Montgomery County, which is a very high retirement county now, and there are good reasons for that. So I think in terms of the report and the planning process is to just sort of be sure we keep laying that out, that's those are happening today. And Middle Tennessee is kind of unusual. I have grandkids that live in Portland, Oregon, which used to be a shining star for transit and for these kinds of things. And their trends are just the opposite of what we're dealing with here because of the popularity of this part of the country and so on.
Yeah, one, our growth is, largely outside of Davidson County,
Yeah.
which is
Yeah.
a difficult problem to address, so. Any other thoughts on these questions?
It was a great discussion. Thank
Yeah.
y'all so much for sharing. I feel like we get into new ideas each time we meet, so really appreciate that.
Yeah, and thanks to Isabel and Emery, we're documenting all of this, so this will not be lost.
Yeah.
So we'll finish off with a couple of questions. What are the most common challenges you encounter when assisting clients with transportation needs? You've answered some of these, so if we need to skip these, that's fine. But are there any obstacles for your organization in participating in coordination of regional transportation service? I think Felix, I'll probably look to you for RTA coordination.
So I guess two things. One is what we talked about, MTA being by charter defined to operate only within Davidson County. So that's always a challenge. In some places, they may have transit districts where you have different transit agencies and there's some arrangements for coordination. On the RTA side, I think it's first the trips themselves, the schedules do not cater to a lot of discretionary trips. So they're designed to be, work trips, and we know that market is getting smaller. A lot of people are either working from home or working hybrid or not necessarily commuting, or working 8 to 5 schedules, whatever that is. But also, I think going to outside counties, at least with those that have other services connecting to their local transit service. We talked about, not having a connection at Clarksville to the park and ride with CTS, or right now where our park and ride in Williamson County is not, it's at the Expo, Ag Expo, so it's kind of outside of their service area. And so those are challenges, or the STAR in Lebanon, Lebanon not having a circulation service. So those are some of the issues in terms of between those two, having to have a better coordination for making options available for people to really consider using the service. So that's a challenge, I think, that hopefully we are aware of the issues, but funding is usually the main detractor. We know what the problems are, and if we have a lot of money and dynamite, we can fix it.
Yeah, I think that's where first thing I think of is we are to get this choose how you move, and we increase RTA service to be, Michael Briggs mentioned every hour. And then also fix a connection, have maybe a Lebanon circulator or, CTS link to RTA service. I mean, that could easily replace a number of trips that Mid-Cumberland might have had to take before, but then, they get to fixed route service. And then that, takes the burden off of them, and they're able to field other requests and maybe not deny trips. So that's the kind of coordination that I think will result in a lot of really good changes. Any other thoughts?
I think the biggest challenge I see from where I'm at, kind of usually the beginning of someone looking for transportation, is just the kind of, deer in the headlights when you hear, oh, you need to have your trip planned 24 hours, 48 hours in advance. Because often people call us. We have, I have a doctor's appointment on Monday and it's a Friday afternoon, and we don't even get to call them back until Monday. So already they've kind of missed that. And I just think that comes from better education and helping people understand more, and really emphasizing, that you have to be more religious about those, 24 to 48 hour rules when thinking about planning your doctor's appointments. And also too, with, Senior Ride Nashville and Access Ride, you don't just call and you schedule a trip. You have to fill out an application. You have to get a doctor's note. And I see a lot of people, just shocked that they have to do that, which I think it makes sense, but it's just a whole new realization that people have to be walked through. And again, just education is something that would fix a lot of that.
And I think one response to that, I think might be helpful as we think through this, is how well connected senior centers, for example, are with their community, and how they can be probably more than we've already realized, a great resource for providing that information so that, you know, the INA team is not the only option, or AgeWell is not the only other option, where they can, because I mean, I feel like the directors of the senior centers, you know, not to place more of a burden on them, but they're really good at disseminating information to the folks that go there, and they have a really great community. I mean, there were almost 100 people at each senior center while we were there, and they seem to go there every day, and it seems to be, you know, their lifeline to avoiding isolation and being connected to a community. So I think in trying to figure out how we can get that information into people's hands before they realize that it's more difficult than they think it is, it's probably good.
This may be down the road in the planning part of our work, but at some point, I think there needs to be more focus on the language we use to talk with people about transportation options. In my experience in public service, I always had no problem using bureaucratic titles, RTA, MTA, CTA, you know, I knew what those things meant. And I remember the experience of being in meetings and talking like that and getting that glazed look at best. At worst, it was stop it. I don't understand what you're talking about with those acronyms. But if there's a way that is a part of our plan, just thinking ahead, that we would initiate a language that if I lived in Sumner County, Humphreys County, Nashville, wherever I lived, the question of how can I get about better, there's a name and a location I can go to. I'm not necessarily meaning physical location, but you know, a website or a number or whatever people are used to looking up information on. And so I don't have to wade through the bureaucratic layers to get to it, and then let the interpretation of which bureaucratic layer you have to go to, let that happen behind the scenes. So just a thought.
That's got a good point. We published, especially this book called The Directory of Services.
Yeah.
It's kind of like the yellow pages, and everything is at a 5th grade level.
Yeah.
Because I've had Mid-Cumberland tell me before that some of their people can't read, and they don't have people who can help them who can read. So I think some of us sometimes who are very educated and we're in the professional world, we use the lingo. And like we'll say AAAD and people go, what? You know, what? You know, so I think that's a good point, is that as we're talking to people in the community, it's really kind of keeping it at a very casual level. And especially going to the really rural counties, you really need to be very casual with them, because they don't want people from Nashville telling them what to do. I've been told that numerous times in the 18 years I've been with AgeWell. So we need to remember that too, as we go into, I see we're going to White House, which I think I've got a suggestion for y'all in White House too, but we need to remember that they don't want people from Nashville telling them what to do, but we also need to make sure we're talking where they can understand, and we're not coming in with that attitude. So,
And I appreciate both you bringing that up. I think it really helped us with our survey. More of a like, all right, how do you get where you need to go? What are the issues that you're experiencing doing that, rather than saying like, what are your transportation challenges and how do you use on-demand service?
that's a totally, yeah,
So
exactly.
that's really helped us, and it definitely wasn't something that we considered before. So
Yeah.
I appreciate that.
And I'm looking at White House. The White House Library is the hub of the community, and those ladies know everybody. So some of these communities getting surveys out to people may involve utilizing other community things besides the senior center.
Mhm.
Because a lot of our older adults don't want to go to the senior center and play bingo.
Yeah.
Even though there's other stuff to do, but the perception is. So, but White House, those ladies at the library know everything, and they'll tell you. So.
Yeah.
Just.
And they've just built like 1 million new buildings in their downtown.
Yeah. They will let you know what's going on and who's doing it.
All right. Well, I think that closes our discussion. Just a couple next steps to be aware of. If you have any additional feedback on any of our materials, or ideas on how to disseminate things, our survey and other other information, please let us know. The survey will be kind of open until the end of our planning process, so it's not closing anytime soon. So, you know, be aware of that. And then our next outreach event is on June 12th at White House Senior Center. Feel free to attend. We'd like some of the providers there. Obviously, you know, Clarksville probably wouldn't make much sense to have you guys attend. So, you know, don't worry about that too much. But then our next steering committee meeting will be on June 18th. That'll be here again. So we'll communicate as we conduct our next events and our continued outreach. And we'll see you all next month.
Thank you.
Thank you.
Great meeting.
Thank you.